Good morning, everyone. I'm Jenna Webb with the SHA, and I'll be moderating the call today. In the room with us are our co-chiefs for the SHA's COVID-19 immunization campaign, Dr. Tania Diener, as well as Sheila Anderson. Also joining us on the phone lines is Chief Medical Health Officer Dr. Saqib Shahab. Dr. Diener will have a few opening remarks, followed by a brief presentation, and then we'll be open for questions. Dr. Diener, please go ahead.
Thank you, Jenna. Good morning, everyone. I'm Dr. Tania Diener. I'm the physician co-lead for the COVID-19 immunization strategy and also a medical health officer here in Regina. And I'm here this morning with Sheila Anderson, who is my co-lead partner and colleague for this strategy. We would like to start off today by acknowledging those who have passed due to COVID disease over the pandemic, and would like to extend our sincere condolences to their families. Severe COVID disease is largely a vaccine-preventable disease if we do have a high uptake of immunization within our community. And for that reason, I really would like to plead again today to everyone who still needs to get vaccinated or who are eligible for their second dose or their booster dose to get vaccinated as soon as they can, and to also encourage others to do the same. I also would like to take a moment to thank our healthcare providers who have really worked so hard during this pandemic, trying to keep us safe and trying to keep us healthy in the hospital where they provide care. We are currently seeing a reprieve in the numbers of new COVID cases, for which we are very thankful for. But we know it's been a long time with very high pressures in the healthcare system, and it's still continuing, and it's going to take some time to also get back up to the services that might have been halted during the pandemic. So really want to say thank you so much for all the work that they've been doing during this pandemic. As we've said before, since we've started immunizing in December 2020, getting vaccinated is really a very important part of our personal protection against the COVID disease. And that's why this morning's announcement is so excited. As of last week, the Public Health Agency of Canada have officially approved the Pfizer pediatric formulation for children 5 to 11 years of age, based on what they know about the safety and effectiveness of this vaccine. So it's really exciting because not only can we protect our kids 5 to 11, but at the same time also save lives overall by putting a damper on the transmission of this virus in our community. So with that, I would like to start with the presentation. Thank you very much for that. So just a reminder that through this pediatric immunization delivery plan, to which Sheila will speak to in more detail lately, we want to immunize our children 5 to 11 in this province in a safe, a supportive, and a very efficient manner. Next slide, please. At the moment, children 5 to 11, or in fact below the age of 12, have the highest incidence of new COVID disease in Canada, and therefore it's really important for us to get them immunized as soon as possible. So the goals of this campaign is to minimize serious disease and death from COVID. It's to protect those that's particularly vulnerable, also protect our health services that not only provide care to those with COVID disease, but also other diseases, to minimize the spread of COVID in our community. And we want to immunize as many people as quickly as possible, but at the same time as safely as possible. Next slide, please. So as mentioned before, clinical trials were conducted by Pfizer on this vaccine, and its efficacy was determined to be 90.7% for this particular age group, with the formulation in the end being approved. Side effects are expected in these kids who receive a dose, but for the most time it resolves within 1 to 2 days after the immunization, and it includes things like a soreness at the injection site, might be a bit of swelling, redness, or systemically they might complain of being tired or fatigued, headache, muscle pain, or chills. But the good news is that after all of these trials, Health Canada has determined that this is a safe and effective vaccine that we can provide to our children 5 to 11. Next slide, please. In terms of this specific formulation, it is different than the adult one because of the addition of a different buffer, which has been used currently in many other vaccines. It's more fridge stable, so it will help us in our delivery process. In terms of the dosage, it will be a smaller volume that will be administered to the 5 to 11 year group, 0.2 ml instead of the 0.3 that we currently provide to those 12 and older. And it's approved by Health Canada to be provided, the 2 doses, 21 days apart. However, based on emerging evidence, more specifically to the adult population, it is recommended that a period of 8 weeks be used between doses 1 and 2 because it shows so far a more robust and a more durable immune response. In other words, more effectiveness, and it might also have an effect on the reactogenicity or the adverse effects experienced by individuals. Next slide, please. Over to Sheila.
Good morning. Happy to be here to share some more operational details of the pediatric campaign. So the Saskatchewan Health Authority, together with its health system partners, are really excited to be offering the pediatric vaccine in the days and weeks to come. We will be using our same tried and true delivery approach we've been using throughout the COVID-19 vaccine campaign to ensure a successful pediatric rollout. So Saskatchewan will be receiving approximately 112,000 pediatric doses. This will be enough vaccine to provide first doses to all 5 to 11-year-olds who will want the vaccine. Pediatric vaccines will be offered to children across the province by providers within the Saskatchewan Health Authority, Indigenous Services Canada, Northern Intertribal Health Authority, community pharmacies, and some family physicians. Over the weekend and just early this morning, we received some information from the Canadian National Operations Centre on the delivery dates of the pediatric vaccine. Vaccine will be arriving in the province tomorrow, Tuesday, and on Wednesday to our larger centres across the province. These centres will be offering pediatric appointments starting on Wednesday for areas who receive vaccine on Tuesday, and Thursday for those areas who receive vaccine on Wednesday. Some of our more rural and remote locations will start the pediatric clinics on Friday. The pediatric delivery will be a staged approach as vaccines distributed across communities throughout the province. Clinics will be set up and delivering vaccine as soon as it's received. The SHA website and social media channels will communicate exact start times and dates in the coming days. Next slide, please. As you can see in the following maps, we're offering pediatric vaccine in every corner of the province. And you can just scroll through the next 5 slides that have the maps, please. These maps show clinics that are being offered by the Saskatchewan Health Authority, the Northern Intertribal Health Authority, Indigenous Services Canada, and pharmacies across the province. These maps will be available on the website for a more detailed look. Next slide, please. Thank you. Next slide, please. And we're encouraging parents, guardians, and other family members to seek out clinics close to home to get your 11 to 5-year-old vaccinated. Next slide, please. Thank you. To support vaccine uptake and access, the SHA is offering a pediatric vaccine in 221 clinics in more than 140 communities across the province. These clinics will be familiar and known to the public and are the same clinics that were offering adult and adolescent vaccine throughout the campaign. A complete list of the clinics and operational hours will be posted to the Saskatchewan.ca website. Next slide, please. We really are expecting a lot of interest and demand for the pediatric vaccine. In the first 2 weeks of the campaign, the SHA will focus on offering vaccine in clinics that can accommodate large volumes. So those are typically our mass clinics or larger community clinics. These clinics will have extended hours and offer vaccine through the weekends. Many of these clinics will be bookable clinics to avoid lineups and avoid having families wait outdoors. The SHA's online booking system will be open to pediatric booking at 8 a.m. on Tuesday morning, so that's tomorrow. And we'll have 2 weeks of clinics available, so through till December 7th, and more will be added to match demand. As the campaign progresses, the SHA will provide more of a target approach that will focus on areas of low uptake. We'll be partnering with community organizations and associations similar to what we have been doing throughout the campaign to date. At the clinic level, we'll have trained professionals on site to answer any questions or concerns, both by parents and children, as well as any of the public. And clinics are designed, our pediatric clinics are designed so mom and dad and other support people can accompany their children right into the vaccination area. Next slide, please. We're offering a variety of clinics where children live, learn, and play. So in the coming weeks, you'll also see walk-in, outreach, mobile clinics with extended hours to accommodate parent schedule. We'll also be offering school-based clinics, either in schools or near schools, and specialized clinics with children with extra needs. It's important to remember that we're going to offer a whole community approach. So you can continue to get your first dose, second dose, booster doses, and we want people to make sure that they know that these clinics are available for everyone. We're also offering and encouraging parents and caregivers to be immunized at the same time as their children. Next slide, please. The SHA has been planning with the school division for many weeks now. Parent and guardian packages will go out through the Ministry of Education and school divisions. The package for parents will contain information you'll need to all the information you need about the vaccine, as well as the consent form for your review. This information can be found at the Saskatchewan.ca website as well. We have engaged in more than 100 schools across the province to date. Dates and times of these clinics will be provided by the schools, and most of these clinics will operate outside of traditional school hours. School clinics will be designed also so that parents and guardians can accompany their children. Next slide, please. We're pleased with the high level of commitment to pediatric immunization from our partners working in community pharmacies. More than 230 will be part of this endeavor. Specific questions on community pharmacies may be answered directly by the Pharmacy Association of Saskatchewan. Next slide, please. Our partners in the Northern Intertribal Health Authority are taking the lead on immunizing children in more than 30 northern communities. As with the SHA plan, there is a lot of flexibility on approach guided by community needs. Next slide, please. Indigenous Services Canada is working with Indigenous communities outside the North to provide vaccine clinics in a flexible manner that also offers immunizations to parents that are interested. Next slide, please. All of the vaccine delivery partners are approaching the pediatric immunization with sensitivity. For many reasons, children and parents might be hesitant. Local partners on the ground are providing assistance to encourage greater vaccination uptake. Next slide, please. A very important part of the work of ISC and NITHA, that ISC and NITHA are leading, relates to the immunization of children and family in a culturally appropriate manner. We understand our partners are engaging elders for assistance, providing information in local languages, and taking other steps to have local needs met. These actions very much align with the approach the SHA is taking. Next slide, please. We know that there's a lot of information and misinformation out there about the pediatric vaccine. We encourage everyone to seek out information from the provincial COVID-19 websites and from other reputable resources such as the Canadian Pediatric Society, and thisisourshot.ca. The Canadian Medical Association has launched a campaign called Max the Vax, with great information both for kids and parents, as do other popular kids shows like Sesame Street. Many of these sites also offer materials in more than one language. The SHA continues to share common questions, answers, and myths on their social media channels. And of course, your family physician and nurse practitioners is a great resource for accurate information as well. Next slide, please. So in closing, as we share the good news of our pediatric vaccine campaign, please consider how you and your family can keep making choices that will keep our communities safe. This means getting your flu shot, getting all your eligible COVID shots. Please wear a mask, wash your hands, and please be aware to take action at the first sign of any symptom. The addition of the vaccine for our 5 to 11-year-olds puts us one step closer to ending the pandemic. Together, by taking the right steps and supporting all those eligible to get vaccinated, we can finish the fight against COVID-19. Thank you.
Thank you. We're now ready to take some questions on the information that was presented today. Please note that today's news conference is specific to the pediatric COVID-19 vaccine, and should you have questions related to other topics, we'd ask that you follow the normal media relations process through the Government of Saskatchewan or the SHA, and we can assist you with some more appropriate spokespeople. I will look to the room first to see if there's anyone with a question. Yes, go ahead.
You're having a significant amount of resistance in this province to parents with what I would gather would be a little bit more legitimate concerns about the effects of the vaccine versus the chances of their child actually getting COVID-19, because it's obviously not a frequent thing that happens with small children. Can you please speak directly to that, to those parents that are legitimately weighing the risk of this vaccine to whatever heart problems or anything else that it might create? And whoever answers that is fine.
I would like to say again that I truly believe that when parents are hesitant about getting their children immunized, it's because out of concern. They just want to have the best for their children. So if there are any specific questions that they have, we need to identify them and we need to try and address them. And if they have an opportunity to speak to a trusted healthcare provider that they have, whether it's a physician, their family physician, their pediatrician, the nurse practitioner, or the public health nurse, please ask those questions. Don't sit at home and wonder about things. Please access reputable websites. There's a lot of misinformation out there. But I want to say they are correct. Children do not get sick as often as adults, and children might not get complications or die as much as adults. But that doesn't mean it doesn't happen. Children can get sick, children can end up in the ICU, and children can die, unfortunately, and it has happened. And especially kids with underlying condition, whether it's a cardiac condition or a respiratory condition like asthma, they might be at an increased risk of having a poorer outcome than a very healthy kid. But I also want to take it further than the children. If children get the disease, they might even be asymptomatically, right, infected, and can spread it unknowingly to those around them. And I'm sure many kids still have elderly grandparents that we also want to protect. So it's also important for kids to get immunized to stop that transmission of the virus in our community and protect others around them.
Is there a follow-up?
Follow-up, yeah. I understand all that, and I appreciate what you're saying. It's a hard sell in a province like this where there's been significant resistance as per the adult COVID numbers, and a significant population out there that's in this category of hesitant for reasons of pure denial or other reasons. What can be said beyond appealing to the fact that, as we all should, we should be committed to our community, we should be committed to a better society? If you're dealing with a situation where my kid doesn't have asthma, I'm just kind of worried it's not really worth the risk.
Great. So Canada approved this vaccine. It's been determined it's safe and it's efficacious. It goes through rigorous testing before they would approve any medication, including vaccines, in this province. The fact that your kid does not have any chronic underlying condition still does not guarantee that if your kid does get infected, they might not fall seriously ill or get complications like multi-inflammatory syndrome, where you get an inflammation of many of underlying organs such as the heart, the lungs, the gastrointestinal system. They might get a serious heart condition like myocarditis or pericarditis if they do get infected. So there's no guarantee that a healthy young kid, if infected, might not develop any of those complications. So it's a much safer approach to get your kid immunized and thereby protected than taking the chance of getting them protected through a disease that might actually cause a lot of complications or even death.
Thank you. Let's take a question from the phone lines, please.
Hamza Beltrandi from Global Regina.
Hi. Yes, I was just wondering. From my understanding, schools are not mandating vaccines, but I was for younger children. But I was wondering with more kids being able to get the vaccine now, could places like daycares or other activities outside of school settings that aren't government related, could they decide to mandate vaccines for this age group that is now eligible?
We'll refer that question to Dr. Shahab on the line.
Yeah, hi. So I did hear the question, so I can respond.
Go ahead, Dr. Shahab.
Yeah,
Go ahead,
thank
Dr.
you. So
Shahab.
I think that's an excellent point, and as was mentioned in the presentation, this is a great opportunity for children 5 to 11 to get vaccinated. A quarter of our cases are in school-age children in that age range. So this will further reduce our overall transmission, and as Dr. Diener mentioned, reduce risk to other families, especially over the holidays. So this is the time for children 5 to 11 to get the first dose. But as Sheila mentioned, there are many clinics that are family-oriented. And so this is, addressing the earlier question, this is a great time for families to come and get their first and second doses as parents, older siblings if they haven't to, and grandparents to get a booster. Now, having said that, for children 5 to 11, obviously, second doses will be sometime in January, February, ideally at 8 weeks. So there's still some time for children to get fully vaccinated, but we'll see the benefit starting right away. Currently, proof of vaccination is not required for children under 11. And I think we'll have to see because, we've said in the past as well that because children can't make independent decisions, it's based on parental consent, it's very hard to keep children out of school or daycare or other settings if their parents chose them not to get vaccinated. But I think this is our last call for vaccines, not just for children 5 to 11, but for families who remain unvaccinated. And again, I'd just like to say, what a privilege for us to have vaccines now for this age group, and how tragic it is still, as Dr. Diener mentioned, to see hospitalization and deaths in people in all age groups who still remain unvaccinated. Thank you.
Do you have a follow-up, Gabriela?
Yes, I was just curious. Oh, sorry about that. Just curious then about, so there's no proof of vaccination process right now for kids that would have to show their proof of vaccination if they went to an event with their parents or something like that?
At the moment, there's no plan for proof of vaccination for 5 to 11. That's correct. Thank you.
Do you have any questions in the room?
Yeah. Will any additional healthcare workers need to be redeployed to help with the children's vaccination campaign, and will that possibly affect other healthcare services?
Yeah, thank you for the question. Right now, we currently have enough resources to be able to effectively roll out the vaccination campaign. So as we've been offering first and second doses and booster doses, we have a pool of staff that we'll continue to use for the pediatric vaccine. So we don't anticipate that to be a barrier.
Okay, is there a follow-up?
Yeah, follow-up. We heard that Wednesday vaccines will become available, I guess, in bigger urban centers. Does that mean that parents can start booking appointments, maybe starting tomorrow or the next day? Like, when does the online booking portion go live?
Yeah, the online booking portion will go live tomorrow morning at 8 a.m. So we'll have clinics out till December 7th, and then we'll be adding clinics as demand, as we see the demand continue to rise. And following that, then our real focus will be out into communities doing a more targeted approach. But for now, we're really focused on booking clinics, although there will be some walk-in clinics across the province too, just to accommodate those who prefer just to walk in as well. But that's tomorrow morning at 8 a.m. The booking system will be available for pediatric bookings.
Take another question on the phone lines, please.
This is Canalis Levine with Global.
Hello, can you hear me?
Yes, we can.
Hi. So I know that you went over a bit of the education process, what kind of resources that parents and guardians can access for their children. Just wanted to see if you can go a bit further on that, just in regards to what schools might be doing on that front, or even what you're hoping you can provide for parents, guardians that are on the fence or that are still uncertain about what to decide for consent.
Me to go ahead. Thank you. Thank you for the question. So we will have a number of resources. So on the Saskatchewan.ca website, there'll certainly be pediatric packages. So those will be packages that will tell you about the vaccine, about aftercare around the vaccine. And we'll go through the consent form, which does talk about the side effects that Dr. Diener spoke about earlier in the presentation. Also on our SHA website and through our SHA social media, we'll have a lot of other information for parents, accurate information. We have questions and answers, like common questions and answers. We also did a Docs with Talk series with some of our children. Dr. Diener and Dr. Kevin Moskow did this, where we had young kids ask questions and have our knowledgeable doctors answer those. So I think that's also a really good resource for parents. Those are typically questions that both kids and parents will want to know. We're really encouraging parents to make sure that they talk to their kids about what they can expect at the clinic, really acknowledge their fears and really walk them through what the side effects might be, and let them know that they'll be right by their side throughout the clinic as well too. So I think there's a significant amount of information out there. Some areas across the province are also planning for parent WebExes, where they talk about the town halls, we call them, where they talk about the vaccine and offer an opportunity for parents to ask questions as well too.
Is there a follow-up?
Follow-up. In terms of the delivery within schools, are these clinics primarily going to operate during school hours, or is there a possibility we can be seeing these school clinics happening after hours or on weekends? What are the decisions on that front?
Yeah, thank you very much. So, as I said, we have over 100 schools that we're currently planning on partnering with to provide vaccine clinics. The majority of them will be offering them outside of school hours. So those will be able to accommodate parent schedules, caregiver schedules, etc. So we should be seeing them many of them are starting in the afternoon and will go into the evening. There may be clinics and where we have a number of schools that are coming into one location to get vaccinated. All of our school clinics will offer parents and guardians a chance to come in and support the children through the vaccination process. There will be a lot of, as you could see on the maps, there's a lot of availability across the province. So communities who offer school clinics during the week will also have opportunities to have vaccine clinics opened in their neighborhood and community centers on weekends as well.
We'll go back to the room for questions. Go ahead.
What is the, I guess, separation going to be recommended for the first and second doses? Because I know Health Canada said 3 weeks, but NACI is recommending 8.
Right, so we will recommend it to be an 8-week period because, as I said, emerging evidence is showing that it will likely have a more robust and a more durable protection, so better efficacy. And it might also have an impact on side effects, but it's only emerging evidence, and it's more based on what they've seen in the adult population. And because it's approved with the interval of 21 days by Health Canada, should parents want to have the second dose administered at an interval less of 8 weeks, we will accommodate that as long as they understand why the recommendation is 8 weeks.
Your follow-up?
And when is the reporting for vaccinated percentage for the province going to be changed? Because right now it doesn't include that younger group. So when is that going to be, I guess, switched over?
We'll direct that comment to Dr. Shahab.
Yeah, hi. I think that's a really looking at when we can change that, but I think we will have to report by all 3 numbers. We will have to continue to report for a while by the eligible population 12 and older, because we know that first and second doses in 5 to 11 will take 2 to 3 months. The first doses completing over the next 4 to 6 weeks, and then the second dose is 8 weeks after that. So it'll take some time. So we don't want to kind of lose focus on 12 to and older. And we also then sometimes show data by the total population, because we know that children under 4 are not yet eligible, but of course they are at risk. So if families are fully vaccinated, including now children 5 to 11, that is also additional protection for children under 5. And of course, getting vaccinated anytime during pregnancy protects your newborn as well, both directly through antibodies and indirectly. But I think there will be, we will have to report on all 3 denominators, 12 and older, which we currently do total and by age group, first and second dose, so that we don't lose sight of that. And then 5 to 11, which will gradually pick up over the next 4 to 6 weeks, first doses, and then later on next year, second doses, and total population. And, we've also mentioned in the past that we need to also now start reporting over the next few weeks on booster doses, because persons 65 and older, 50 and older in the north, it's critical that at 6 months they get the booster doses, and going forward, further age groups will become eligible. So we have to keep an eye on all 3 reporting parameters. Thank you.
A few more folks on the phone lines. We'll take the next question, please.
We have Marcia Musili with CBC Radio Canada.
Hi there, good morning. Can you guys hear me okay?
Yes, we can. Go ahead.
Awesome. So I just wanted to know, so you said that schools are not providing vaccines right now. Can we know when these schools would be, when the date is anticipated for these schools to start delivering vaccines for children from 5 to 11?
Thank you for the question. It really varies across the province. Some schools in some areas will start quite quickly, while other centers will wait for a week or 2 to start bringing clinics into the schools. Of course, all of those 5 to 11-year-olds will be eligible and will be able to go to any vaccine clinic starting tomorrow, as I said. We've been really working with the school divisions and making sure that we're picking dates and times that work for the school division. So it varies a little bit across the province.
Is there a follow-up question?
Yes, definitely. I was wondering, so how will parents know whether the school where their children are going will be offering the vaccines? Will there be a list up on the website, or will there be a note sent by the school? How will that work?
Yeah, Definitely the school will be, excuse me, notifying the parents of the clinics that will be in their area or in their children's schools. That will come directly from the school.
We'll take the next question on the phone lines, please.
We have Phil Tank with Star Phoenix.
Hello, can you hear me?
Yes, we can. Go ahead.
Yeah, I'm wondering about how many, like you mentioned that there's 112,000 doses, which is expected, one dose for every child who wants one. How many are you receiving this week? And do you expect to get, are you expecting to get that entire number of first doses within, that time frame between December 7th? I guess my larger question is there any concern that, these kids won't be fully immunized until sometime in the new year, which takes us past the holiday season? And, we saw how the virus spread last year during the holiday season to November, December, and even into January. So I'm just wondering if there's concerns there that about the rollout of this. I know it's happening as soon as it can, but what's the messaging there? So maybe Dr. Shahab can weigh in too. And thanks.
We are receiving the 112,000 doses of vaccine this week, and we will have enough vaccine to vaccinate all of the 5 to 11-year-olds for their first doses. And maybe we could let Dr. Shahab comment on the next delivery.
Yes. I think, the provinces have a pull system. So based on uptake for first doses over November, December, and any second doses that may start later in December or January, we will be able to pull more doses to make sure that everyone is able to get a first and then ultimately a second dose in January, February. So we don't anticipate any pressure on vaccine supplies at this stage. But obviously, we don't want to over-order either, because as you know, the pediatric vaccines are a reduced dose, 10 micrograms. So they are specifics for 5 to 11. So we only want to order as much as we anticipate using. So, our hope is that there'll be high uptake, but if uptake is low or slow, we only want to order as much as we need. And I have not heard of any pressures on vaccine supply for the pediatric population or for other adult populations who, are still eligible for first, second doses and increasingly for booster doses. Thank you.
Is there a follow-up, Phil?
It sounds like this is. I'm sorry if I missed this, but it sounds like this is basically like a first come, first served sort of approach, unlike kind of the original vaccination rollout, which prioritized some people, older people obviously, and people with immunocompromised conditions. I'm just wondering if there's any accommodation for children with immunity issues, and also on the symptoms. When I look at the symptoms, they sound very similar to the symptoms for adults. Is there any difference in the symptoms that children might experience? Just in case there's a parent out there who says, "Oh, geez, I didn't experience that," but they're having a different sort of reaction than I've heard of in adults.
Maybe I can make a couple of comments, and Dr. Diener can speak on the side effects, and Sheila Anderson can also speak on other aspects of delivery. But you're absolutely right that in the early days, January, February, March, vaccine supply was extremely limited, and it was by age groups. Initially long-term care, healthcare workers, and then in age groups. And if you remember, every 3 or 4 days, the age range would go down by 1 or 2 years. So those are very challenging times. Now we are in different space. We will be getting vaccines for everyone 5 to 11. Obviously, as Sheila mentioned, there's lots of clinics all over the place. And there may be a bit of a rush first 1-2 weeks, but I think, and Sheila can speak to further, but anyone who wants to get a vaccine should be able to get it in a timely way, the first dose over the next 1 or 2 weeks. And if they require an earlier second dose before 8 weeks, that would be available as well, although 8 weeks is recommended. But I would want to defer to Sheila for further elaboration on that, and also to Dr. Diener on further details on side effects and how they're different from adults. I've heard they are much milder from the data emerging from the trials and the US. Yes.
can comment first, Tania. I agree with you, Dr. Shahab. I do think there'll be, a lot of demand in the first couple of weeks. Our teams are really dedicated to getting these vaccines in arms. So as you could see on the maps, we are really having a broad-based approach where we're offering vaccine across the province in a number of different ways. There'll be lots of different hours that you can get a vaccine as well too. So I'm anticipating that although demand will be high, we'll be able to match that demand and just continue to design the pediatric vaccination campaign as the campaign rolls out and meet the needs of individual and unique communities. But there will be, we don't anticipate any vaccine shortage, and we are ready ready to get those vaccines in arms.
Dr. Diener?
Thanks for the question about the side effects. As I've mentioned in the presentation, what they saw in the trials was really minimal side effects lasting about 1 to 2 days, and included either local reactions that can include redness, swelling, or pain at the injection site, or minimal systemic effects like fatigue, malaise, chills, etc. So from the trials, it definitely looked as if it's less than what adults experienced. There were no serious side effects identified. There were no safety signals identified. There were no deaths identified. This was smaller in numbers, so obviously the extremely rare side effects that might show up, we wouldn't have been able to pick up in these trials. But things like myocarditis, pericarditis, none of those were identified as a side effect during any of these trials. Thanks.
Thank you. We have 2 more reporters on the line. We'll take the next one on the phone, please.
We have Allison Bamford with CTV Regina.
Hi there. I know you've said that urban centers are going to be getting the vaccines first. I'm just wondering if you can tell me which communities would be getting them on Tuesday and Wednesday, and if all 141 communities will have doses by the end of the week.
Thank you for your question. So we know that vaccine is arriving in Saskatoon and Regina tomorrow. So those clinics will open on Wednesday. And in places like Prince Albert, North Battleford, Yorkton, and Swift Current, vaccine will arrive there on Wednesday with clinics opening on Thursday. So we have a number of secondary distribution sites that we're distributing the vaccine to throughout the rest of the week as well too. I can't say right now whether all 140 or 221 clinics in the 140 communities will receive that by the end of the week. But as we work through our distribution and logistics process, they'll be receiving them and be getting them in arms as quickly as possible. As you know, based on our campaign that we've already ran, that, in smaller centers, some of those clinics are rotational. And so, they're in a certain community on a certain date or a couple times a week. And so, again, we're using the same method that we've used throughout the vaccine campaign to offer this pediatric vaccine too. And just as a reminder, they're not just pediatric clinics, they're also clinics for public to come. If you don't have a family, you're certainly welcome to come and continue to get your first dose, second dose boosters, and we'll also be offering influenza as well.
Do you have a follow-up, Allison?
Yeah, I'm just wondering, it's been said that vaccinating this age group will help us get out of the pandemic. We know this age group makes up about a third of new cases. I'm wondering how responsible the 5 to 11-year-olds are for transmission, and I guess what impact and when are we expecting to see cases drop even further because these people are getting vaccinated now?
I can start responding, and then maybe Dr. Shahab can continue. I think it's very difficult to quantify how much they do contribute. But as Dr. Shahab said, they make up a very large percentage of new cases in this province. and the same for the rest of the Canada. And I almost want to say I believe that's likely an underestimation, because we know that the more also can be asymptomatic, even if they infected, thereby spreading the virus to others without themselves even knowing that they infected, because they don't have any symptoms. So I think what we know about cases in this age group might actually be an underestimate. Also very difficult to say when we might see an impact because of immunizing these kids, but what we definitely know for sure is that they will help to break the transmission rate, to bring it down, and stop this virus from spreading at the current rate in our communities.
And the only thing I'll add is that we already know that transmission happens at the household level, at small private gatherings for the most part, sometimes within schools, although that's lower than expected due to the other precautions in place, and of course, sometimes in daycares. So this will definitely have an impact at all those settings and also more broadly. But we have to remember that it's still critical that families, all members of the family get vaccinated. It's critical that daycare staff get vaccinated. We should expect 99%, close to 100% vaccination rates in daycare staff, in school staff, in coaches, for sports teams, all those settings where children are. But together with the high vaccine uptake, that still needs to increase in 12 and older, and now 5 to 11. I think this will, over the next 4 to 8 weeks, make a dramatic difference overall. Will further reduce numbers in geographies which already have high vaccine uptake. But we have to be very clear that unfortunately, parts of the province with low vaccine uptake will continue to face the brunt of COVID, including hospitalization and death, irrespective of overall increase in vaccines in children 5 to 11. Thank you. Thank you.
Do we have anyone else on the phone line with a question?
We have Yasmin Ranea with CBC.
Hello, can you hear me?
Yes, we can.
So the government says it's not interested in mandating COVID vaccines for students. So how can the province ensure good vaccine uptake among children?
We'll ask Dr. Shahab now.
Yeah, that's a really important point, but we have to remember that we have done really well in Canada and in Saskatchewan with other childhood vaccines. We have some of the highest rates in the country, 90-95%. So parents have always gotten their children vaccinated for all other vaccine preventable diseases. The COVID is just like another vaccine preventable disease now. So, it is up to parents to be comfortable and bring their children to get vaccinated. But we also know that, right now, the surge we saw, the fourth wave we saw, and the hospitalization deaths were not primarily in 5 to 11. 5 to 11 getting vaccinated further help in reducing community transmission, but we still have pockets of low vaccine uptake that also need to move forward, people getting their first and second dose, and increasingly people getting their booster doses. And I'll quickly mention that obviously workplace requirements, the need to have proof of vaccination if you're 12 and older in many settings is increasing vaccine uptake, but it has stagnated. And we also know that if you fully vaccinated, eligible for a booster, getting a booster does not change your eligibility for being fully vaccinated for POV, but a booster dramatically decreases your risk of hospitalization and death. So for people 65 and older, there's a great personal stake in getting a booster to further reduce your risk of breakthrough illness, especially after you cross that 6-month mark. Currently recommended for 65 and older at 6 months and 50 and older if you're in the north. Thank you.
Do you have a follow-up, Yasmin?
Yeah, also for Dr. Shahab about the booster shot. So other provinces have announced that all adults are now eligible for COVID booster shots. When will this happen here?
In principle, everyone 18 and older will be able to get a booster at 6 months. But, we will be phasing that in because, as was mentioned earlier, the initial vaccine doses were just given strictly by age. So right now, people who got their, second dose in May are eligible for booster at 6 months. So these are, for the most part, people who are 65 and older or 50 and older in the north, as well as healthcare workers, and of course, clinically extremely vulnerable, immune suppressed as well. So right now we have a bit of time because people are not becoming eligible at a younger age for a few weeks. But having said that, I think all of us should note in our diaries, when do we reach our 6-month anniversary after a second dose and expect to get a booster, everyone 18 and older. Thank you. And further announcements will be coming over the next few weeks. Thank you.
That's the end of all of our questions today. The presentation as well as the maps will be posted with the news release on Saskatchewan.ca. Thank you.